Good evening. Kids can be pricky or non-stop eaters, and they'll complain about stomach pain when they're grumpy or not even say a word when their stomach really hurts. While most kids eventually settle into predictable eating patterns, and most childhood symptoms such as stomach aches will go quickly as they come. Some digestive problems in children can actually be a sign of something more serious. Do you know which red flags to watch for and when to consult a pediatric gastroenterologist? To know more on the common pediatric gastro problems in children today, we have with us our expert, Dr. M.S. Viswanathan, pediatric gastroenterologist and a hepatologist at Apollo Children's Hospital, Shafi Mohammed Road, Chennai. Good evening, doctor.
Good afternoon, everyone, and it's nice to connect to you guys today. And let us talk through the common gastrointestinal problems today.
What are the common gastro, digestive, and digestive problems in children today, doctor?
So, very interesting to start with because 10 or 20 years back, I would say that the common problem in our country and also across some other countries was diarrhea. But whereas nowadays we see more and more of constipation. When I mean constipation, in Tamil it is malachikkal. Okay, constipation is a very common problem nowadays. When I was in UK, we used to see every day at least 10 cases, 10 children a day. But in India, in Chennai, now I do see quite a lot of young children to have significant constipation. That's the number one problem I see every day. And the number two problem, parents come to see me with the problem of their children having abdominal pain, tummy pain. That's a very common problem, and that could be for any reasons. And the third problem I would say still is the diarrhea, the loose stools. It's still a problem there, and we see a lot of diarrhea, particularly the diarrhea. What I see is that there is long-standing diarrhea, which means the diarrhea lasting for more than 2 weeks, 3 weeks. That's the time I tend to see them, because most of the other short course of diarrhea, like 5 days, 6 days, do get seen by general pediatricians, and they do care of these children very well. The other problem is important problem is vomiting. It's a very common problem again in babies and in children, and this is what we call as gastroesophageal reflux, or this could be due to anything else. And the other problem is could be due to related to liver, which is a jaundice. These are the common problems I see almost on a daily basis.
We've got a number of questions from parents of children who are aged almost a few months old to almost 10 or 11 talking about constipation being a very common issue in their kids today.
Yes, a very common problem. See, I think what's happening is as we keep saying that we're a developing country, I will say some parts of our country is already developed very much. We do have urban sector and then rural and semi-urban and everything. So what I see is obviously there's a big change in the diet and the dietary habits compared to what it was 10 or 15 years ago. So what we tend to eat is a less and less of fiber in the diet and more of junk foods. When I mean junk foods are those which has more of sugar or more of fat or more of salt. These are the main things, and these things actually slow down the movement of the food what you take in the gut, and this results in constipation. So no wonder I see more and more of this problem nowadays in our country, because our food habits has changed a lot significantly in the last 10 years or so.
What are the symptoms of gastric problem in children, doctor?
So when you mean gastric problem, I want to first tell people, when you say tummy pain, abdominal includes so many things in the tummy. Meaning the first one is you have this, let me start GI tract. First is your mouth, then you have the food part, then you have the stomach, then it goes to the small intestine, cerebral, then you have the large intestine, perigudal, then you have the rectum, which is basically the malakudal, where the stool stays there for a longer period of time before it comes out. And and then and when you mean stomach, தமிழ்ல வயிறு வயிறுனா வந்துட்டு வெறும் இரைப்பை மட்டும் கிடையாது. வயிறுன்றது includes small intestine, large intestine, and also in the abdomen we have something called liver, கல்லீரல், we have gallbladder, பித்தப்பை, and we have pancreas, கணையம், and we have spleen, which is மண்ணீரல். இதெல்லாம் சேர்ந்து தான் வந்துட்டு ஆக்சுவலி GI tract, GI system. அது தவிர உங்களுக்கு வயிற்றுல வந்துட்டு கிட்னிஸ் இருக்கு, அது தவிர வந்துட்டு reproductive organs இருக்கு. அதை பற்றி நம்ம இன்னைக்கு பேச போறதில்ல. இன்னைக்கு பேச போறது mainly we are going to talk about this GI tract, which is what to say, kudal ஈரல் அந்த சம்பந்தப்பட்டு தான் நான் பேச போறேன்.
We have a question from one of our viewers. How do I know if my baby has an intestinal problem?
Again, I say the intestine could be a small intestine or a large intestine, which is a sirugudal or perigudal. Sirugudal starts after the stomach. The small intestine starts after the stomach. So when the food, when we eat, it goes through the mouth into this food pipe into the stomach. Then it has some sort of digestion in the stomach. Then it goes to the small intestine, where you have duodenum, jejunum, and ileum. These are the parts of small bowel. Here again, what happens? Each part, there are many components in the food. You all know that food. That you have got protein, you have got carbohydrate, you have fat, which is மாவுச்சத்து is carbohydrate, protein is புரதச்சத்து, and fat is கொழுப்பு சத்து. இது மூணுமே ஒரு ஏரியாலையும் it gets digested in different ways, and it broken down into smaller particles as the food moves along the gut and the small intestine. So intestine problem என்ன நடக்கலன்னா what happens? The first thing is you all know that digestion ஆகல. Oh, my baby is not having digestion problem. What happens? Something they say they come with a gas. Okay, that's one thing. And second thing is you all know the diarrhea. Again, the diarrhea which we're talking about, the diarrhea can happen because the food is not getting absorbed properly in the intestine, or when I mean malabsorption. That's what we call. The third thing what we can have is something called block. What we call is adaptive. Block means what happens that number பிறக்கிற பேஸ்ல இருக்கிற சில பார்ட்ஸ் ஆஃப் ஸ்மால் பவுல் சரியா ஃபார்ம் ஆகாம இருக்கலாம். What we call is duodenal atresia. இந்த duodenalத்துல வந்து 4 பார்ட் இருக்கு, ஏதாவது ஒரு பார்ட் சரியா ஃபார்ம் ஆகாம இருக்கலாம். இல்லைன்னா what happens is there could be a problem in the jejunum or ileum. Sometimes what happens in children, very common thing we need to make as I see sometimes is the twist, the bowels comes like this, like now the mari, it comes like a ribbon or like a snake or whatever we call. When it get twisted, okay, twist what we call is malrotation or valvulus, whatever it is. நார்மலா வந்துட்டு நம்மளுடைய வயிறு வந்துட்டு சிறுகுடல் பெருகுடல் வயிறு எல்லாம் ஒரு சர்டன் பொசிஷன்ல இருக்கும். அந்த பொசிஷன்ல தான் கரெக்டா ஃபுட் மூவ் பண்ண முடியும். ஆஸ் யூஷுவல் நம்ம வீட்டில் இருக்கிற பிளம்பிங் சிஸ்டம் மாதிரி தான் கரெக்டா இருக்குன்னு எல்லாம். அந்த சிஸ்டம் கரெக்டா இல்லைன்னா இஃப் இட் இஸ் த அதர் வே ரவுண்ட் த ஃபுட் கேனாட் பாஸ் ப்ராப்பர்லி, இட் கெட்ஸ் அப்ஸ்ட்ரக்டட், பிளாக் ஆயிடும். ஸோ வாமிட் எடுக்க ஆரம்பிச்சிடும். இப்போ இந்த மாதிரி குழந்தைங்க, திஸ் செட் ஆஃப் சில்ட்ரன் வாட் ஹேப்பன்ஸ் இஸ் த வாமிட்டிங் வில் பி கிரீன் கலர். நார்மலி வாமிட்னா நம்ம வந்துட்டு எல்லோ கலரா இருக்கலாம், லைட் எல்லோவா இருக்கலாம், கொஞ்சம் டார்க் எல்லோவா இருக்கலாம். பட் சம்டைம்ஸ் when there's a block, அடப்பு ஏற்படுத்துனா what happens is they have a green color vomit. Green is due to the bile. Bile is normally reduced in the duodenum, and then it goes down to the other parts of the small intestine, and then it gets out to the feces. இது சரியா போக முடியல, கீழே போக முடியல அப்படின்றது, it's unable to pass down, then it gets up, and that's the reason why you see the green color, which is called bilious vomiting as a medical term. This gives an idea there is a problem in the bowels of blockage. So the intestine problem could be, as I told you, could be due to malabsorption, digestion, it could be a diarrhea, or it could be a block.
So what should one do? What should a parent do in case he or she witnesses such symptoms in children?
Yeah. When somebody has a bilious vomit, when I mean bilious vomit, green color vomit, definitely, or manja color vomit. If you have any doubt, see your doctor soon. Especially green color vomit is an emergency. Okay, we need to see the doctor soon, because sometimes surgery தேவைப்படலாம், because we need to do some basic blood tests and ultrasound scan பார்த்துட்டு bowel கரெக்டா இருக்கா, பொசிஷன் இல்லையா. ஃபார் எக்ஸாம்பிள் யங் சில்ட்ரன்ல, இந்த யங் பேபிஸ்ல குடலேற்றம் அப்படின்னு சொல்லுவாங்க, இன்டர்செப்ஷன், அதுக்கு பேர் மெடிக்கல் டேர்ம். இன்டர்செப்ஷன் நம்ம பவுல் இப்படி இருக்கு, ஒரு பார்ட் ஆஃப் த பவுல் இன்னொரு பார்ட் ஆஃப் பவுல் இப்படி உள்ள போந்துக்குது, அதனால சரியா ஃபங்க்ஷன் ஆக முடியாது. இந்த இடம் இதை போய் நல்லா கம்ப்ரஸ் பண்ண ஆரம்பிச்சிடும். ஸோ அதெல்லாம் என்ன, இந்த இடம் வீங்க ஆரம்பிக்கிறோம், இல்லை வந்துட்டு இந்த இடம் சரியா செயல் இழக்காம செயல் இழந்து போயிடும், இட் வில் லூஸ் அ ஃபங்க்ஷன். பிகாஸ் பிளட் வெசல் வந்துட்டு ரொம்ப கம்ப்ரஸ் ஆகுறதுனால, அதுக்கு பிளட் சப்ளை சரியா போகிறதுனால அதனுடைய டைஜஷன் ஃபங்க்ஷன் பண்ண முடியாம போயிடும். திஸ் இஸ் கால்ட் இன்டர்செப்ஷன், குடலேற்றம் சொல்லுவாங்க. அது குழந்தைங்களுக்கு 6 மாசத்துலேருந்து 1.5 வயசு வரை 2 வயசு வரை வரலாம். மால் நியூட்ரிஷன் சொல்லியிருக்கேன், பவல்ஸ் வேற மாதிரி இருக்குதுன்னா, இந்த மாதிரி பிரச்சனை இருந்ததுன்னா இம்மீடியட்டா வந்துட்டு நம்ம வந்து சர்ஜரி பண்ண வேண்டியதா இருக்கும். இது எப்படி தெரியும்னா, சொன்ன மாதிரி கிரீன் கலர் வாமிட், இல்ல குழந்தை ரொம்ப அழுதுல இருக்கான், சாப்பிடவே மாட்டேன், unable to eat anything at all, and is significant pain, and we have to see the doctor immediately.
Hello doctor, my son aged 8 years old has a very poor digestion for the last 2-3 weeks. He complains of stomach pain every time he eats something. Is there a serious concern?
So I think a stomach pain, as I say that, I used to say to my all my parents when I see them, it's a very common problem. And if you keep asking a child, you're having a tummy pain, 9 out of 10 times they say yes. So never ask them whether they have a tummy pain. But however, if they're having pain, which means that it is not allowing them to eat properly. They're vomiting a lot. They're not sleeping properly at all. And they're in significant pain, especially, it doesn't allow them to play at all. Children like to play. They say a toy, they're bound to go and run and get the toy and then play. They don't play. Or if they don't engage themselves, with other children, they don't want to watch, something which they like every day, which means that something serious to worry about it. Then the doctors has to be seen immediately. So significant pain which lasts more than 5 minutes, 10 minutes, or hours, or pain in the night time, especially waking the child from the sleep, and then vomiting associated with the pain, especially I told you previously bilious vomit, அந்த மாதிரி pain இருந்ததுன்னா vomit இருந்ததுன்னா இல்ல child is not at all eating well, child is losing weight, and there is associated fever, or the certain pain irukku சில பேருக்கு they will have problem with the bowels, they can have diarrhea, they can have constipation, or they can have blood or mucus, மோஷன்ல வந்துட்டு ஸ்டூல்ல வந்துட்டு மலத்துல வந்துட்டு blood இருக்கலாம் இல்ல சளி இருக்கலாம், blood or mucus could be there. ஸோ இந்த மாதிரி ப்ராப்ளம் இருந்ததுன்னா பெயின் வந்து இக்னோர் பண்ணக்கூடாது, டாக்டர் உடனே பார்க்கணும். எஸ்பெஷலி the pain is lasting more than 2 weeks and they have associated symptoms, or even the pain is 1 day or 2 days, if you have this kind of symptom, then you have to see the doctor immediately. But however, if the pain ஒன்று தான் இருக்கு, மற்றபடி குழந்தை is doing very well, is active, is not having any vomiting, is sleeping very well, is playing very well, the pain comes and goes in 2 minutes, 3 minutes, then I don't worry too much about that.
Hello, doctor. My son has fever for the last 4 days and vomiting since 3 days. The episode is happening very frequently for the last 2 to 3 days. Especially in the morning, she complains of an abdominal cramp kind of a pain.
Childhood is for 4 years, isn't it?
Yeah.
Okay. So I think, there is a very short history here, 3 or 4 days fever and vomiting. The most common thing we have to think in this sort of scenario is food poisoning. What I mean is they would have eaten food outside recently, or they would have had food even at home, might be infected somewhere. So this is a common reason for having a fever, vomiting, and stomach cramps. And now, if the child is not having loose stools too much, then you can start a painkiller if your doctor given before. But the important thing before you give any pain medicines, always make sure that you have the doctor's prescription, just a recent prescription. Generally, recent prescription will be within 1 week, not more than that, because children weight changes, and then we have to make sure we give the correct dose for the correct weight. And also important thing, the same medicine, for example, paracetamol, I keep saying this, paracetamol, the same company produces the paracetamol in different strengths. For 5 ml 125 இருக்கலாம், 250 இருக்கலாம், 500 milligram இருக்கலாம், same company, same brand, they have different strengths. So we have to work on what exactly the dose for the child for that particular age. So அதனால தான் சொல்றது, the paracetamol simple medicine தான், but you have to be very, very careful. So you can give the medicine to start with, then go and see your doctor. But this is the most common disease of food poisoning. So sometimes the most common reason of food poisoning is a virus infection, not necessarily bacteria. Virus infection, you don't necessarily need antibiotics. Fever irukku, paracetamol koduthu, if it's getting better, or and vomiting irukku, you can give something called ORS, which is oral rehydration solution, which is uppu sakkare karasan. There is available small packet, and is also available large packet. The small packet, you mix it in 200 ml of water. 200 ml is 1 cup, approximately 1 glass, I will say. 1 liter is for the large packet. Don't interchange it. Small packet has to be mixed with 200 ml of water. Large packet has to be mixed with 1 liter of water. Vomiting irukkurappo, main thing what you have to do is we cannot give too much at the same time. You have to give small volume. The child could. So sometimes the children, when you give it, they drink a lot because they are thirsty also. But konjama give it in small amount. But you can give over a period of 20 minutes, 30 minutes regularly, 5 ml, 10 ml, or 15 ml. Give regularly. Make sure. But the child is vomiting a lot. In spite of that, then the doctor has to be seen immediately. So fever medicine, vomiting medicine. So in infection, so this is an infection. So it's a virus infection. You can give the medicine. That's a supportive treatment. If it's a bacterial infection, your doctor will decide whether the child needs antibiotic. There is no need to overuse antibiotics. That means that we should use antibiotics only rationally. So bacterial infection இருந்தால் தான் நமக்கு வந்துட்டு ஆன்டிபயோட்டிக் தேவைப்படுது. வைரஸ் இன்ஃபெக்ஷன் தேவைப்படாது. பேக்டீரியல் இன்ஃபெக்ஷன் டாக்டர்ஸ் சில க்ளூ இருக்கும், ரொம்ப ஃபீவர் இருந்துகிட்டே இருக்கும், எமோஷனில் பிளட் ஆர் மியூக்கஸ் மைட் பி கமிங் தேர். இந்த மாதிரி விஷயம் இருந்ததுன்னா we will think about starting antibiotics soon. or ரொம்ப சின்ன குழந்தை, இப்போ நம்ம பேசின குழந்தை வந்து 4 years, ரொம்ப சின்ன குழந்தை, less than 6 months, less than 3 months, or the child had other problems, வேற ரொம்ப நாள்பட்ட ப்ராப்ளம், chronic disease இருக்கு அப்படின்னு இந்த மாதிரி குழந்தைகளுக்கு வந்துட்டு we are more inclined to start antibiotics sooner, or immunocompromised immunity ரொம்ப கம்மியா இருக்கு, cancer patient, இந்த மாதிரி சமயத்துல நாங்க we will change the medicines accordingly.
We have our patient Mampi Som from Bangladesh. Sir, my son is 14 years old. Whenever we are out of station, he faces a problem of vomiting and diarrhea right from his childhood. Is this a serious problem? Should I consult a specialist ASAP? And what are the precautions in that case if it's not serious that I should take to avoid such tummy upsets?
It looks like vomiting mainly, isn't it?
Vomiting and diarrhea as
And
well.
diarrhea there. See, what's happening is, what's important is a 14-year-old boy. So what you have, this is if the child is very well at home, only if the problem happening outside food, it gives me some sort of idea the child is generally okay. There's nothing serious there. But however, if it's happening outside, you keep your food diary. Okay, what food exactly brings the symptoms? Is it just some sort of pizza or pasta or wheat-based food, or is it something sugary drinks, or is it carbonated beverages? What sort of food actually gets his symptoms, makes his symptoms worse? That's the thing we need to know that. Depending upon that, we can adjust. No, we can give some sort of explanation or some sort of advice. The reason I'm saying this is that if your child is very well at home, which means there are two reasons. The child is doing very well, and the important thing is you are cooking good food for your child. Okay, outside food obviously is not good, and for many reasons. The outside foods are tasty for the children for 2 3 main reasons. They got more sugar in it, they got more fat in it, and more salt in it than normally you need to put it. These are the main reasons why the outside food tastes much better, and then you get addicted to that. Nothing wrong with having an outside food. Once it's 3 weeks, 4 weeks, you can have it. But if your child is having a symptom on a regular basis, it's better to avoid it. Or probably you can do the food which is okay with you. If your child is not having severe vomiting or weight loss, or if your child does not have blood or mucus in the stools, you don't have to worry. But if the diarrhea process is longer than 3 days, 5 days, especially if it's a blood or mucus, there's a fever there, and your child is not gaining weight, then you need to see the doctor soon.
Can you tell us a little bit about acid reflux in babies, and if hiccups are one of the symptoms of acid reflux in babies less than a year old?
Acid reflux, let me talk about reflux. Let's say acid reflux later on. When you reflux, you have the food pipe coming here from the mouth, the food pipe. Then you have the stomach. Normally, from the food pipe to stomach, there is a valve, and that valve closes. It doesn't allow the food or the acid or the liquids like water to come back from the stomach to the food pipe. So it goes down. The valve closes. Sometimes in some children, if the valve doesn't function properly, the food can go up from the stomach back into the food pipe. So ஸ்டொமக்லேருந்து திருப்பி உணவு குழாய்க்கு வர வாய்ப்பு இருக்கு. ஸோ அதனால தான் that you will notice the symptoms கொஞ்சம் எரிச்சலாக இருக்கலாம். It means it's acidic reflux. Sometimes the reflux acid இருக்குன்னு அவசியம் கிடையாது. What we call alkaline reflux இருக்கு இந்த காலத்தில். நம்ம முதல்ல கண்டுபிடிக்கல, இப்போ லாஸ்ட் 10 இயர்ஸாக கண்டுபிடிச்சிட்டு இருக்கிற விஷயம் தான். அது ஆசிடாக இருக்கும் மட்டும் அவசியம் இல்லை, அல்கலைனாக கூட இருக்கலாம். ஸோ ரிஃப்ளெக்ஸ்னா என்னன்னா பேசிக்காக your food or liquid items or even the acid going back from the stomach back into the esophagus. கீழே போகாம மேலே வரதான் இது ப்ராப்ளம் எந்த வயசுலையும் வரலாம். சின்ன குழந்தையிலேருந்து பெரிய வயசான வரை யாருக்கு வேணா வரலாம். அது பேபிஸ்ல most important you need to know this, 90%, 95% of the time it's normal. That's a good thing. That's a good news, isn't it? Because babies tend to small amount of positive burping. That's the positive. I mean, small amount of milk comes soon after the feed. That is normal. No need to worry about that. Majority of them is normal. And again, over the period of next 6 months, 18 months, it gets better. So again, in children up to 1 year, 1.5 years is usually not a problematic. However, your child, if they have a problem with weight gain, or they're unable to sleep, they're having severe pain, then the doctor has to be consulted soon. The main important parameter is Your child should be active, should play well, should sleep well, and should gain weight. That's very important. If this is not happening, then you see the doctor soon. And older children, the common or problem வரலாம் எப்படி வரலாம்னா when it can happen, when you consume these carbonated beverages, or when you take too much of tea, coffee, or when you take too much of spicy items, masala items, or some teenage boys can, when they smoke, these things can happen. Okay, or even in older children or older adults, I mean, they take alcohol, it can, all these things can happen, can contribute to reflux. Reflux means basically food coming back from the stomach to the food pipe.
How can I strengthen my baby's digestive system? This is a question asked by most of the parents.
I think when you mean strengthen, what do you mean by strengthen is just to make sure. When you mean the question digestive system, my child has normal stools. That's the main thing. And my child puts on weight normally as usual, and the milk doesn't have vomit. These are the main things I would say. So when you mean that the food is very important, there's a saying in Tamil, unave marundu, marunde unavu. What do you mean is basically the medicine is the food is what is actually the medicine. Okay, so if you play with your food, you end up in having a lot of problems. So as long as your food is home cooked, which is a traditional Indian food, I say whatever part of India, the traditional Indian food is good, as long as it doesn't have too much of sugar, too much of fat, or too much of salt, it's good, not a problem at all. And if you have this kind of homemade food, and if your child is taking this, assimilating, digesting, I'm pretty sure, and if your child is gaining weight, your child is having a healthy gut, and there is no need to add anything extra. What is commonly needed for the food is protein, carbohydrate, and fat, which means that child needs to have cereal. Cereal includes rice, wheat-based items, and millets, the sirudanyangal. Your protein includes all sort of legumes, dals, lentils, or also you need something like you can take boiled egg. Egg is good, especially the boiled version is very good. It's a good source of protein. And you can take fish once a week, and the other non-vegetarian items, mutton, chicken once in 2 weeks, not a problem. And also the good source of protein includes this rajma, channa. There are beans items, are a very good source of protein. And fat, you need fat for your body, the don't know about it. You need cholesterol, but you shouldn't consume too much. Milk is a relatively good source of fat, and your daily products, all the daily products, a good source of fat. And most important, I used to say to people, you can have buildings like with all sort of cement, bricks, and everything. But if you don't have nuts and bolts, you can't join. This is what the nuts and bolts are: vitamins and minerals. And vitamins and minerals comes mainly from the fruits and the vegetables we eat. And there's also good fiber in them. Not the juice I'm talking about. I'm talking about raw fruits, nicely washed. And when I mean vegetables, I mean nicely cooked vegetables. These things are good source of vitamins and minerals, and also good source of fiber. When these things are in place, your children are going to have a good digestive system.
How do you test for gastrointestinal infections, doctor?
Okay. Gastrointestinal infection means predominantly they usually present with diarrhea. Or sometimes they can present with vomiting. When I say this, majority of them is virus infection. If this 2 days, 3 days, don't do any test. They don't need it. Honestly, they don't need any test at all. But what they need is, I keep saying to people, to my patients or the parents, I'm not giving medicines to treat your infection. It's going to stop on its own. Because, God has, or the nature has given a system in a way that it's excreting all the bad items all the bad bacteria through the stools or to the vomit. Let it go, that's nothing a problem. But what is most important during this time is we need to make sure the child is not getting dehydrated. When I mean dehydrated, வற்றி போகக்கூடாது, நீர் சத்து வற்றி போகக்கூடாது. அதான் மெயின் விஷயம். அதுக்கு தான் நம்ம சொல்லிட்டு இருக்கோம், ஓவரா சொல்லிட்டு இருக்கோம். But now we are also giving something called zinc supplements. It's available all in the government sector or private sector, everywhere it's available. So zinc supplements is also important. So these things are important: hydration, zinc, and sometimes you can give something called probiotic, which your doctor will tell you best. And because which is good for which sort of disease, only it's better to be tested by a doctor actually. So if you are having this, no need to test anything for infection. But however, if your child is having diarrhea or blood in the stools, or mucus in the stools, especially diarrhea is lasting for more than 5 days, 6 days, high temperature, child is not taking anything, then it's good to check your stool for infections like bacteria and also to viruses. Or we also check some special bacteria if the child had antibiotics for a long period of time. Then you do the test. And if your child is looking very dehydrated, ரொம்ப நீர் சக்தி வத்தி போயிருக்கு, ரொம்ப dehydrated இருக்கான், is not taking enough food, enough drink, and is not passing enough urine, you know, then we check something called electrolytes in your body, your salt level in the body. And during that time, it's better to be observed in the hospital for 6 hours or 8 hours to make sure that you drink. So this is a basic test I will do only that your child absolutely needs it. Short lasting diarrhea, 2 days, 3 days, GI infection, gastrointestinal infection, no need for test.
Why do babies grunt a lot, doctor?
Grunting is basically a symptom of respiratory disease. It's basically a symptom of a lung problem, usually. Okay, or it could be sometimes part of a sepsis infection. Okay, grunting gives an evidence of a problem in your chest, or could be a problem in your blood as it's infection. Okay, this is the main reason. When your baby is grunting, you need to see a doctor immediately.
Can you tell us a little bit about jaundice in children?
Jaundice, when I mean jaundice, is yellow coloration, discoloration of your eyes. Okay, if you see the sclera, which is the white color of your eye, white part of the eye, it's normally white. If you see yellow color, that's called jaundice, or in Tamil you call that as manja kamare. Okay, so when you have this problem, usually the problem could be in liver, or sometimes rarely in the blood also. What happens? Why jaundice happens? Normally in your blood you have hemoglobin. It breaks down, it produces bilirubin. This bilirubin is normally excreted or metabolized by your liver. Okay, so if that's a problem in your liver, you can have jaundice. The jaundice could be due to a variety of reasons. Could be due to an infection. Common reason our children in our country still is infection, like a viral infection, what we call as hepatitis A, or sometimes some parts of the country we have hepatitis E. The common reason for jaundice in our children is virus infection. And second thing, we have got something called the disease called Wilson's disease. We have something called copper. It has to be metabolized. If there's a problem in this copper metabolization, then you have something called Wilson's disease. And the other thing is something, the rare disease is called autoimmunity. I don't want to talk about that. But I want to say something important about a very important cause of jaundice. And that is in a newborn period, first 30 days to 45 days of life. That is called biliary atresia. What do you mean biliary atresia? What do you mean by biliary atresia is the bile ducts are not developed properly. When I mean bile duct is basically a small pipe connecting your liver on your right side down to the small intestine. Liver produces bile, but the bile has to reach from the liver through the bile duct, which is the pipe, to the small intestine, where it helps in the digestion of your food. That's very important. Bile is very important, particularly in the digestion of fatty foods. So if the bile duct, the bile pipe, if not developed properly, your bile cannot go from the liver into the intestine. Your bile stays in the liver. Bile, when it stays in the liver for a longer period of time, it is not good for the liver. It damages the liver. So this problem is called biliary atresia. Your bile is an important substance in your body to make your stool, feces, malata, to make it colored. Whatever color you see, green color, bit of yellowish, dark yellowish, that color is given by the bile. If the bile is not entering from the liver into the small intestine through the bile duct, your stool becomes pale color. When I mean pale color, whiter, chalkish color. It doesn't get colored at all. There's different colors there, கலரவே இல்லை சார், ரொம்ப டல்லா இருக்கு, ரொம்ப ஒயிட்டா இருக்கு, pale color, chocolate chalk piece color. This is also not a good sign, which means that the bile duct is not developed properly. For these children, it has to be seen very urgently by the doctor, pediatrician, or pediatric gastroenterologist, the hepatologist, because we need to relook this important condition, biliary atresia. If it is not developed properly, we have to get these children have a surgery done soon Because if you do the surgery before 60 days or before 45 days after birth, the chance of this disease, I mean, you are recovering from the disease is quite good. If you are seeing your doctor very late, after 60 days or after 90 days, after 4 months, the surgery may not work very well. But having said that, jaundice க்கு நிறைய காரணம் இருக்கு. So many reasons are there. This is one important reason I don't want anyone to miss. Parents or your doctors don't need to miss this one. Because if you do the surgery earlier, if you diagnose the disease earlier, if you do the surgery earlier, your chances of recovering the disease is very, very good. But other reasons are also there for the newborn period. It could be infectious, or it could be also something called metabolic liver diseases. Your liver is very important in the digestion of protein, carbohydrate, and fat. எல்லா பார்ட்டிகளும் சின்ன சின்ன பார்ட்டிகளா don't get broken down in the gut. It all gets absorbed through the blood into the liver. It goes to the liver. But there are a lot of enzymes are produced by the liver. Lots and lots of enzymes produce the liver, which actually breaks it into minute particles. And it removes the toxic products from all these food components. So, this the liver has a problem in their enzyme system. Your food is not going to be broken down into non-toxic product. Apo, you have a lot of disease, and that's also can manifest as jaundice. So, that's important to know that if you are presenting very late, the biliary is கண்டுபிடிக்காம ரொம்ப லேட்டா நீங்க டாக்டர்ட்ட பிரசன்ட் பண்ணீங்கன்னா, nowadays we have to go straight to liver transplant.
Speaking of liver transplant, Apollo Children's Hospital, Chennai is known for its liver transplant. Could you please elaborate a little bit about that?
Yeah, I think it's very important that people have to know that. For a liver transplant, especially for any liver transplant, you need to have a very good team. In Apollo Children's Hospital, there's a very good team available. When I mean very good team, you need to have a physician to assess, a pediatric hepatologist to assess, a pediatric transplant surgeon, a very important member. And you need to have something called intensive care, pediatric intensive care, when there's a group of intensive care specialists who takes care of these babies when they have the surgery done. And they're also for the next 2 or 3 weeks, very important people. And then we need to have special radiologists, which means that they are the people who does imaging, who looks at the scans, and there are special radiologists particularly trained for this kind of people. And also we need to have other people like dietitians, pharmacists, etc., and anesthetists also. We need a very important member of the team is anesthetist, because they are the person who takes care of these children during the surgery to during the transplant. They are specifically trained for these things. So we need to have the entire team, which we are able to provide in Apollo Children's Hospital. And here we are doing something called liver transplant, living related liver transplant. I'll come back to that. And Apollo Children's Hospital has got Children's Hospital itself has got a separate license from the government for pediatric liver transplant. All this liver transplant in children or adults is regulated thoroughly, very systematically, structurally by a transplant body in Tamil Nadu or also in other parts of India. And in Tamil Nadu is very strict transplant bodies available, which is called Transplant. And all the transplant patients, their donors, everybody will be assessed. Will have to go to this system before actually we go ahead with the transplant. So I said we can do living related, and the second thing is cadaveric transplant. When you mean cadaveric transplant, getting a liver from a dead person. Okay, and the good thing nowadays is from a dead person the same liver can be used to transplant to 2 recipients. Liver is the only organ in the body which regenerates. Good thing is you give a small part of the liver to a child, it grows in the child, it grows in the adult. So liver in the right side irukku, left side irukku. The left lobe is chinna part eduthu kuandhaiku chapo. This left lobe is enough for a child, and the right lobe you can give it for an adult. So for one liver from a dead person, you can benefit 2 persons, one an adult, one a child. And living related வரப்போ உயிரோடு இருக்கிறவங்க கொடுக்கிறது. Okay, the person who are living or donating their part of the liver. The good thing again here is for children, you need only a part of the liver, which is left lobe is enough. Amma, appa, mainly usually parents are first degree relatives. And again, their identity will be checked thoroughly by the entire transplant team, which includes the medical team and the non-medical person. They will check their identity before actually one can donate. Nobody can say just like that and can donate. The identity has to be proved. So father, mother can give a small part of their liver to the child, which is left lobe. Before we take the small part of the liver from the parents, we thoroughly assess the adults. I mean, we thoroughly assess them. We assess their liver. We check whether they got diabetes, cholesterol problem, hypertension, whether their other organs are fine, heart okay, kidneys fine. We check everything in that, and also we check the liver in detail. Also liver vessels, everything is looking okay or not. If the liver is suitable, if the patient is fit, if the adult is fit, and the liver is suitable, then only we will recommend for the donor to give a part of the liver to the child. Once that is done, we will take the liver. Saying the theatre, two teams will be there. One will be taking a part of the liver from the adult, the donor. Dana kodukkondu liver எடுத்துட்டு போறாங்க. இன்னொரு team babies, children, they will be keeping the baby ready. Because the reason we are doing the liver transplant in a living, the good thing of the living liver transplant is there is no, your liver dead person liver எடுத்துட்டு we have to be transferred from some other center to this center. அதில் கொஞ்சம் வெயிட்டிங் இருக்கிறதுனால அந்த லிவருடைய ஃபங்க்ஷன்ஸ் கொஞ்சம் டேமேஜ் ஆகலாம். ஓகே, வேற குட் திங் about living related to liver transplant is you are doing on the table the liver, you are getting straight away from the parent. One of the parent we are transplanting the child as soon as possible. So one team the parents then they will be taking the liver, other team will be getting the child ready to receive the liver. So this will be done at the same time, and this is being done in our hospital institute, and we have done around 65 to 70 liver transplant for various conditions. As I told you before, the important reason for the biliary atresia is sometimes the children have surgery, or the children and the surgery would not have worked well for them. They continue to have a problem, or sometimes they were present very late when we had to do a transplant as a straight surgery. Sometimes, as I told you, metabolic liver disease. There are a lot of metabolic liver diseases which can be cured by liver transplant. And sometimes when people present acute liver failure, the children will be very well, would have been nice, no problem at all, 2 or 3 days back. Suddenly they would have some infection, some problem would have happened. All of a sudden they would have get the liver failure, acute, immediate liver failure, ரொம்ப problematic. If you don't transplant, the children will die. And the conditions, indications are there for transplant. So there are various reasons. The importance is biliary atresia, which is progressing in spite of the previous surgery, or metabolic liver diseases, or acute liver disease, or other chronic liver disease. Not patta vyadhi irundhathu dirindha acute liver failure aachi. Acute disease, acute liver failure on a patient who has already a chronic liver disease. You can transplant, but before you do the transplant, you strictly assess the families if they are willing to donate, particularly the parents, which is the one who are willing, usually are willing to donate, and we assess the child strictly to see whether the child is suitable to receive the transplant. Because the child should be suitable. There are some conditions, there are few conditions where we do not recommend liver transplant, particularly if the child has a problem affecting the heart, affecting the muscles, affecting the nerves, brain. We don't recommend liver transplant. So we assess thoroughly who will benefit the maximum, and then we get the donor assessed. Then we will go ahead with the transplant, provided everybody in the committee approves to go ahead with the liver transplant. It's a very strict system in place.
Thank you very much, Doctor. Finally, closing notes. What would be your message to our viewers today?
I think if I want to say one message, compared to last decade, this decade, the problem we see more is actually constipation. Honestly, it's a constipation main problem, and a lot of functional GI disorder, which I did not discuss in the interview. When I mean functional GI disorder, people are stressed a lot. Okay, you do all the tests, you don't find any problem, any medical problem. The pain is real. The children are having pain real. We don't find a problem for that. This could be due to stress related. These are the two common problems we see on a regular basis in our hospital. constipation we can regularly, avoid or prevent by taking good food and good exercise. The children has to play minimum 30 minutes, 40 minutes a day. Good food, good habits, good exercise activities, and regular toilet training, sitting the toilet seat morning or evening. This you can take care of constipation. The second thing, functional GI disorders. I would strongly emphasize or I suggest parents or the caregivers not to put too much stress or young children. They are doing very well. They will do very well. I tell you honestly, we shouldn't, the stress, the pain, the stress can cause pain. So, like headache, some people they get headache. Similarly, some people get stress, they can get stomach ache. So we have to take care of these two. These two are taken care. Majority of the children, especially the GI tract, they won't have much problem. But obviously, with the problems we have discussed already, they need to be addressed by a doctor on an urgent basis.
Thank you very much for a detailed and informative session, Doctor. For appointments with Dr. M.S. Viswanathan, consultant pediatric gastroenterologist and hepatologist at Apollo Children's Hospital, Shafi Mohammed Road, Chennai, you may reach out to +91 +9144 2829 6262. I repeat, +91 44 2829 6262. Thank you, Doctor.
And thank you very much for your patient listen. Thank you.